That's all up joint or what?
Do I hold it like this or the other way? Or like that?
It doesn't matter.
Alright.
Editing is happening now. Okay. Imagine your child is having hundreds of seizures a day. Would you resort to using medical marijuana if it could improve their way of life? The sources are medicalmarijuana.procon.org, the Mayo Clinic, time.com/potkids. Medical marijuana, Procon, again because I went on a different page, and my mother, Helen Cotiller. Medical marijuana is used to help treat certain medical conditions that our medications can't help. The person keeps having reactions to them, or it's not working for them. The problem is the FDA won't approve medical marijuana because they haven't done large enough studies on it yet. They've done some, but not on a large scale. And most people don't see how it could possibly help with those conditions. The solution is there needs to be easier access to information as to what it does, how it helps, and all of that. Some of them, the FDA just needs to do big enough research on it. We're going to talk some more on the seizure disorder part because it affects it the most because of it. Seizures actually kill more people every year than breast cancer does, yet it only gets 20% of the funding that breast cancer receives. Reactions to medications that I've had are stroke-like symptoms, ringing of the ears, weight loss, lack of sleep, IQ points have been lost, and suicide to certain medications. Marijuana comes in different forms. It's not just you smoke it and that's it. They can put it in your foods, gummy bears, you can put it in your drinks. There's even oils, cannabis oil, that can be used. And it's actually just as effective, especially when you're using little kids and you don't want them smoking it, or you may not like the idea of your child eating pot gummy bears. So it actually, medical marijuana, it slows down the brain and calms the whole body. And for a person who's having seizures, that is a major relief to feel your muscles relax. And with seizures, your brain is going all the time. So that slowing it down actually helps the number of seizures that you have a day slow down. Along with seizures, medical marijuana also helps with anxiety attacks, panic attacks, anger issues, and hyperactivity. The FDA won't approve it. They don't see the benefits of medical marijuana. But yet, when they do test medical marijuana versus a placebo, the patients who use medical marijuana actually do better than the ones receiving the placebo. But because they haven't done a large enough study, and they don't quite understand how the different strands and all the different chemicals actually do to the person long term, they won't approve it. And other people say they just want to get high. So, that's a problem too. The solutions that would be making access to information on what it does, how it affects the body, how it affects your brain, your lungs, all that. We need easier access to that information. We need larger studies done on it so people can see it. That way they can't say, well, they just want to get high and do it legally and not go to prison. There's actual benefits to this. And for people to push for the FDA to approve it, because if they don't push for it, the FDA is not going to do it. So, and I've talked with people who have done it, and they say that it does help. And right now, the only side effects that are known is you get hungry and you want to go to sleep. which, quite frankly, is a lot better than stroke-like symptoms and not eating. It is harder for people to get access to that information because it varies so much. I think I said this slide. And the challenges that the people face who actually need it, because the FDA won't approve it, is they're having to take it over state lines, which is still technically illegal. I mean, there are people in Colorado who make certain strands for certain disorders. Like, there's a strand called Charlotte's Web, and it's named after a girl named Charlotte. She had over 300 seizures a day. Our parents had tried it, but the chemicals weren't right. So it didn't work. So they went to Colorado. She went from having over 300 a day down to less than 5 in a whole month. There are children who can't talk, and they can't talk, they can't go
Got a
to
low
school.
battery.
It's fine. They don't have a normal life. And because of the cannabis oil, or their parents put it in their food or their drinks, whatever, they're able to talk and walk and have a normal life that a child should have. But since the FDA won't approve it, there's only a few kids that are being helped because their parents are willing to take that chance. But not everybody is willing to do that. Okay. Medical marijuana is actually very helpful to people with those certain conditions, as you can see. And most of them, that's not their go-to thing. That is their last resort. When they have tried everything else and everything else fails them. When they keep having reactions that you have to take more medication to reverse that reaction from the first medication. Or you have to go on so many different ones because not one of them can help. You have to have 3 or 4 or 5 or however many ever the doctor says. And then you have serious reactions to all of those, and then it's start from the bottom. Let's see if this works. And you're getting prescriptions thrown at you left and right. So, like I said, it is helpful to those who need it. Perfect.
Yeah.
Correct balance.